A hearty good afternoon and welcome to a session on PCOD Awareness. We're glad to have Dr. Sita Sharma among us today to help us understand the topic. Polycystic ovarian syndrome, or PCOD or PCOS, is a hormonal disorder common among women of reproductive age. Now, PCOD, women with PCOD may experience infrequent or prolonged menstrual issues, excess hair growth, acne, infertility, and weight gain. Women with PCOS also may be at a higher risk for type 2 diabetes, high blood pressure, heart problems, and more. So it's necessary for us to have awareness on this topic. It's good that we have a doctor with so much experience on this topic over here to help us understand this. And doctor, you have the stage.
Yeah, thank you so much. Good afternoon, viewers. I'm Dr. Sita Sharma from Apollo and Fertility, Amritsar. September is the month of PCOS awareness. So I've chosen this topic to make you more aware about PCOS. The slides are not moving. So PCOS, as the name indicate, polycystic ovarian disease. Poly means many and cystic means cyst-like spaces in the ovary. These are basically not the actual cyst. They are actually they are small sacs, fluid-filled sacs. These sacs are usually present inside the ovary. These are known as follicles. So these are normal follicles which are abundant in number, which are present in the ovaries. They are abundant in the ovary, and so the ovary is enlarged. That is why this become a polycystic ovary. So this polycystic ovary, as you can understand that the polycystic ovary is having number of follicles is more than the normal, and they are causing some kind of hormonal disturbance. That is why this syndrome arises. Polycystic ovarian disease patient usually come with the report of the ultrasound carrying in hand wearing the polycystic ovaries, and sometimes they say that डॉक्टर हमारे तो ओवरी में कोई रिसोली हो गई. Actually this polycystic ovarian disease is not a risoli. There is no surgeries to be done in all the cases in these patients. This is only that there is some hormonal, metabolic, and some other disturbances which which I'll be making you aware of. That is the purpose of taking this topic today, because just see that the whole of the month, September month, has been dedicated to this disease, polycystic ovarian syndrome. So this is very important to know. Can you So I'll be taking up the problems, how this polycystic ovarian disease occurs, how the problems taken up. First of let's discuss what is the function of the ovary. In the female body there are two ovaries, right and left, and the normal size of the ovary is around 6 to 7 cc, and the normal ovary they produces eggs and the hormones. So the eggs are produced in the ovary with the onset of the menstrual cycle. A crop of the follicles, there are small sac-like structures which starts growing. This follicle contains the eggs. They start growing in number, and then these follicles they grow, and one follicle becomes dominant, and that will release the mature egg. So this mature egg will release, and if the female is in the reproductive age group and she is married, then at that time if she has intercourse, and then she will become pregnant. But if in case of unmarried woman, or in case of the couple who is not planning for pregnancy, then the menses will be there. So the in polycystic ovarian disease, the follicles are there, but they are not able to become mature. So this is because of the disturbed hormonal milieu inside the body. So that is what causes anovulation. Anovulation means there is no ovulation, and then there is infertility. And in among the young girls, when there is no ovulation, they find difficulty in getting the normal period. So they come to us with the complaint of oligomenorrhea or no periods. And then there is a weight gain. The patient usually come with weight gain. They are bulky, they become obese. And the other important symptom is the acne or hirsutism. Acne is presence of hair on the chin, there is male-like pattern of hair, acne on the face, and these symptoms become the patient become more disturbed with these symptoms of acne and hirsutism. So they come with the increase, they are because of the increased male hormone which is produced by the ovary. In the normal ovary, the male hormone is there, but it is very less in quantity. Usually it is very less in quantity. The female hormone estrogen and progesterone are more. But what happens in the polycystic ovaries, the female hormones, in spite of the female hormones, ovary started producing the male hormones, so they become the symptoms, they become androgenic. These androgenic symptoms are there, like there is weight gain, there is excessive hair growth, and also there is increased hair loss, that the normal hairs become lost, and they sometimes the female can say that my hair on the this on my scalp or on my head, they are thinning. So these are various symptoms. Apart from this, there can be headache, there can be insomnia, there can be depression. So because of if a young unmarried girl is coming to us, she wants to have regular periods, she is not getting her regular periods. And if a married couple is coming to us as a infertility, they come to us as an infertile couple, they are not able to conceive. So normal ovary is producing the normal hormones, it is producing the eggs. But a ovary which is having lots of follicle, it is polycystic ovaries. They are actually pseudocysts, they are not actual cysts, and they are full of the abnormal hormones, like they are androgenic, and then they are producing all the symptoms of PCOD in the body. So mainly the symptoms of amenorrhea, obesity, and hirsutism. Amenorrhea is not having the regular periods, and hirsutism is having abnormal hair and acne, and obesity means weight gain. So other symptoms, there can be, patient can have psychological depression, there can be pelvic pain also. So the patient does not find herself comfortable. The symptoms though, so there are three kinds of basically problem which I will be discussing. One is not having normal ovulation, that is anovulation, which causes menstrual disturbance, which causes infertility. Almost 20 to 30% of the patients are coming to infertility clinic because of the PCOS, because of the non-formation of the eggs. So then there second part is androgens. Excess of androgen, of course, it will lead to menstrual disturbance and amenorrhea and anovulation. Excess androgen will lead on to the hirsutism, acne, and weight gain. And also there are black lines of the neck under the breast, and this is called acanthosis nigricans. This is also peculiar of PCOD patients. So when we say that this patient is having PCOS, these were certain criteria which was designed by scientist Rotterdam. These are we call as a Rotterdam criteria. We see that if the ovarian volume on ultrasound is more than 10 centimeter or more than 20 follicles are seen in the ovary, and there is an oligo or low ovulation, and there are androgenic features, like there is features of hypoandrogenism, there is hirsutism, there is acne, there is acanthosis nigricans. So these out of these three, the two criteria should be present to patient to label the patient as PCOS patient. So we have to look for not only one symptom of weight gain, or one symptom of having abnormal periods, or one symptom of infertility. This will not label you as a having a patient, becoming a patient of PCOS. We have to have two criteria out of these three criteria I've mentioned. So why are we worried about this problem? We are worrying, and there's a whole, just think, whole month has been dedicated to the PCOS as PCOS awareness month. 1 month is dedicated. So it is very important to know about the various sequelae and various complications and various problems associated with PCOS. And the main is, as I told you, that this is affecting the woman who is in the reproductive age group. So which starts from the 13 to 14 years of the life, and it goes till menopause. So this is a disease of that period in which the female is reproductively active. Like she will get her normal period, she has to conceive. So this is a disease which is hormonal and which is confined to the reproductive age group. And the incidence is increasing day by day. Incidence is increasing. Why the incidence is increasing, I will discuss in my later talk, but it is increasing because of our faulty dietary habits also. So incidence is increasing, and the associated problems with it they are also increasing. It is because of the lifestyle, and it is causing more lots of stress. 20% to 30% of the patients are coming with infertility, and it is also associated with the insulin resistance is the basic central key factor which is causing the obesity. So it is associated with diabetes. Later on complications, patient can come with diabetes, cardiovascular risk factors, and then hypertension. So this is very important to be aware of PCOS, and it is better to prevent from the further complications. If we just look at the causes, there can be genetic causes, there can be it runs in the families, and there can be a change in the lifestyle, diet, and stress. So PCOS is a lifestyle disorder also, because the lifestyle we are going through now, our young generation is going through now, they are taking like lots of junk foods which are high in calorie, liquor, beers, and cold drinks. They are having lots of empty calories, and they are sedentary lifestyle. So the most of the works are done on laptop, on mobile. So the young generation is lack. They have a lack in physical activity. So our lifestyle is becoming that this disease is on the rise, and also it has a genetic predisposition also, because I have seen many patients or many sisters having this same problem. So this disease run in the family also, but still far I cannot clearly say why this happens to you and why this has not happened to you, because some females and the young girls say this, ये तो इतना खाती है, इसको क्यों नहीं है? So everything has its genetic predisposition also. So obesity can lead to insulin resistance and also hyperinsulinemia. Rather, PCOS dietary habits can lead to obesity, and obesity can worsen again the sickly and the complications of PCOS. So obesity can cause PCOS, and obesity can be a result of PCOS. This is also a topic of debate. So excess insulin is because of the insulin resistance the body is having in these PCOS patient. Because of the obesity, there is excess insulin, and because of the excess insulin, there is increased in the hormone. LH is a hormone which is secreted from the pituitary. FSH and LH are very important hormone in female reproductive system. And when there is excess of LH, then there is anovulation, then there are the other sequelae like menstrual disturbances, and there are increased androgens. Androgen is a male hormone basically, which is causing the normal female, which is disturbing the normal female hormones, and it is causing hirsutism, it is causing acne and lots of problem there. So basic problem is the central key point is insulin resistance with resulting hyperinsulinemia, and there are androgen excess, there is anovulation as I just discussed. So what are the various long-term effects? Long-term effects can be diabetes, hypertension, dyslipidemia, there can be breast cancer, there can be recurrent pregnancy loss, and there can be endometrial carcinoma also. So that is why the awareness about PCOS is very, very important. So there are some myths and facts about PCOS. Some patients say that is it like that all women of PCOS are obese? No, this is not like the thing. No, not the this is a myth only, because PCOS has two varieties. One is obese and one are thin. So thin lean PCOS is also there. The pathophysiology or the cause is the same. Like they also have LH increase, they also have androgens increase, they also have hyperinsulinemia, and more or less the treatment is same in both the cases. Another myth which I have seen in patients' mind is that contraceptive pills are the only treatment of PCOS. उनको लगता है कि जब हम डॉक्टर के पास जाते हैं तो साइकिल रेगुलेशन के लिए डॉक्टर हमें ओरल कॉन्ट्रासेप्टिव पिल्स पे ही डाल देते हैं, तो और कोई ट्रीटमेंट तो है नहीं PCOS. And I have seen many patients once prescribed by the doctor to take PCOS pills for 3 months, and they are taking for their long life. So this is not so. PCOS may usually we always stress on the nutritional diet. We stress on, we just advise you to have good exercise and healthy environment, and start taking home cooked food which is rich in nutrients. I always advise my patients not to go for fast food or junk food which is available in the market, which is man-made. Go for nature-based fast foods. Nature-based fast foods are green vegetables, then fruits are available, then dry fruits are available, then you can have nariyal pani, you can have lassi, which is readily available and that nature has given. This fast food is given by the nature. So this nutritional uh, the advice and with the weight loss is very very important in PCOS. It is not only that you are giving always given oral contraceptive tablets. Some patient ask that because I am having menstrual problem, is that only one symptom is sufficient to label me as a PCOS patient? No. The As I told you, there is Rotterdam criteria which always take into consideration when we label a patient as PCOS. There are three criteria like there is oligo or anovulation, there is excessive androgens, and there is PCOS picture on the ultrasound. So when out of these two criteria is met, when the patient is labeled as PCOS, and then we start advising the patient about the hormonal and non-hormonal treatment as well. Pregnancy is not possible in PCOS patient. This is also a myth because PCOS around 75, you can say 60 to 70% of the patient conceive with just advice for weight loss, diet, and just lifestyle change. And most of the patients after losing 10% of the body weight, when the weight is lost, or also say about female is around at present she is 80 kg, if she lose about 8 to 10 kg of weight gain, then it is very easy for her to become pregnant because ovulation resumes, egg banna shuru ho jata hai, and that is the only problem in PCS. Because of the hormones you are not able to form eggs. The egg follicles are there in the body, but they are not able to become mature follicles and they are not able to rupture, and there is no timely eruption of the egg. That is the only problem. So if we solve that problem, then you can become easily. Like even then 20 to 30% of the patient has to attend the infertility clinic for further treatment. So let's summarize. The cause of the disease can be genetics, and also the lifestyle is same important. There are hormonal changes, and most important is insulin resistance, androgen excess, and LH high. So how we treat these? When androgen is high, like how will they will cause the symptoms like hirsutism. Hirsutism is excessive facial hair, and there can be acne, there can be weight gain, and there can be muscular body like males. And when insulin is excessive, hyperinsulinemia or insulin resistance is there, there can be weight gain, there can be this will call the metabolic syndrome, which is like diabetic, cardiovascular risk, hypertension, and because of these two, there will be ovarian follicles will not be able to mature and rupture. There can be anovulation, and there will be excessive estrogen. Couple, if they want to conceive, they will find difficulty in conceiving. But there is no reason to panic. It is no difficult. It is not a difficult task to diagnose and to treat. But only you have to motivate yourself. You have to motivate yourself that because you are going to prevent all the complications, all the problems related to PCOS. See, PCOS once is there, it is going to remain for the whole life with you. But you have to only to treat and only to control the complications associated with. So it is not difficult part. It is you just follow your doctor's advice. You just start taking the normal healthy diet which our dadis and nannies used to take home cooked food. Don't take any fancy diet, and also also change your lifestyle. Add some kind of activity into your lifestyle. I'll come one by one to all of this. So what is the role of exercise in PCOS? So I always send my patient that anything is better than doing nothing. See, if you cannot do anything, just dance in your home at your favorite number, or don't use lift in your office, just use stairs. use count the account बड़े लोग steps count करते हैं, तो it is better if you count at least 10,000 steps per day. So it is better to do anything than nothing. So ideally a session of aerobics or high intensity exercise will work. Exercise which leads to lots of sweating will cause the help in the calorie loss. Consider activity tracking, and also beware of over exercise also, because that is also not good. So what benefit is going you are going to get with the this exercise? This will increase the insulin sensitivity. PCOS, the central key point is insulin resistance. Your body is not using insulin adequately. So this will increase the insulin sensitivity, help in reducing the blood pressure, help in restoring your fat metabolism. It burns calorie. Of course, it reduces weight and it reduces the blood glucose also. So now I come to the nutrition. इट इज नॉट टू टेक फैंसी डाइट. ऐसा नहीं है सुबह पोहा बनाकर खाइए, रात को स्पेशल डाइट लीजिए, किनवा लेने बाजार से जाइए. जो आपके घर पे है वही खाइए. ठीक है. टेक द न्यूट्रिशन डाइट, न्यूट्रिशियस डाइट, वट एवर इज अवेलेबल. So what, but there is no one plan work for everybody. So you have to see what are your needs, what is your daily requirement, how busy you are. If your life is sedentary, सारा दिन घर पे रहते हैं, जहाँ you are already very busy, so you have to plan your meal like that. But I will say, take a livable, and you can say take a plan which you can rely upon. ये नहीं आज आप खा लोगे, दूसरे दिन भी आपने खाना है, तो take a plan which you can follow daily. So take home cooked food, use the oil which is available. It is not only that you have to use olive oil only. You can use mustard oil, which is easily available in Punjabi families. Then the only thing is you have to decrease your carbohydrate intake. I'll just quote up an example. Take a plate, small size plate, not a big plate. Just divide into half. One half you will fill the plate with vegetables and fruits. So your diet should be like this. I'm just giving you an example because I want you to decrease your carbohydrates and fats. You have to take good amount of proteins and good amount of fruits and salads. So divide the plate in two halves. One half, 50% of the plate should be full with fruits and salads. And then out of the other half, one quarter, one fourth of the plate should contain protein. Protein can be white of the egg, protein can be dal, katori of the dal, or sprouts you can say, or any nuts, chane. This is just quoting an examples of protein. You can take in being vegetarian, non-vegetarian, you can have soup. Then soup of pulses, or soup of chicken, or soup of egg if you are non-vegetarian. Then one quarter of the thing is only required, that is carbohydrate. Carbohydrate हम जो अपनी डाइट में लेते हैं, that is गेहूं, आटा and chawal. So you have to cut down the intake of the carbohydrates. So decrease your carbohydrate intake and increase your protein intake, because protein takes lots of time to burn. You will always feel full. If you take lots of fiber fruits, your stomach will feel full and you will be taking less of the calories. So the funda is to decrease weight, to take less calorie, and by exercising you will burn your calorie. It is said that if you burn around 7,000 kilocalories, then you will decrease 1 kg of weight. It is not very easy to decrease the weight. So how will you do this? You decrease 250 calories per day from your diet, and 250 calories you burn with your exercise. So roughly in 1 year you will lose 1 kg of the weight. So this is how you can plan. And you take foods which is low in glycemic index, and then take a small and frequent meals. बड़ा बड़ा 3 बार खाने की बजाय you take 6 to 7 small meals. They will increase your metabolic rate. So you will burn calories and you will also take less of the calories. That is the funda behind it. So now there are insulin sensitizers which are available in the market and pharmacy. First line of treatment for PCOS, normal, married, unmarried couple, it is the diet control, lifestyle change, and third comes to the insulin sensitizer. Metformin and another insulin sensitizer are available, which are usually prescribing to the patients, especially who are obese. These insulin sensitizers will help to lower your blood glucose level, and they will decrease the insulin resistance in the muscles, and they will lower the androgen levels, and they will help in the weight loss also. So, and it is said that with the help of the insulin sensitizer, the ovulation also becomes better. So it helps in the infertility patients also. So now Reaching at the treatment part, there are two kinds of patients in PCOS which we are dealing with. One is unmarried patient or who do not want to conceive. Second is a patient who wants to conceive. So there are two different lines of treatment for these patients, and one line combination or in which suits to both of them is the weight loss, lifestyle change, taking good diets, remaining stress free. Also these patients are very much always in stress. Depression cases are also seen in patients of PCOS, so it is very important for them to follow some yoga program or for meditation program. So weight loss, lifestyle change, insulin sensitizers, they can be given to both. And if an unmarried woman wants to have regular periods, depending upon her hormonal value, which will usually get it done on second, third day of the period, we give her oral contraceptive tablets if it is required. And then if a married patient is coming who wants to conceive, then we need to add to her ovulation inducing drugs. First line of treatment is with the oral drugs like letrozole and clomiphene, and the second line of treatment, if she is not able to conceive, with letrozole, clomiphene, metformin, lifestyle change, weight loss, and giving some time also. Then we go to shift to the second line of treatment, that is addition of certain hormones like HMG, FSH. And if it is not able to conceive again, then the third line of treatment for these patients is IVF. So PCOS is treatable in any way as the requirement of the patient. And if some patients can be like that who have already completed the family, so in those patients we need to treat the PCOS to prevent the further complications like diabetes, dyslipidemia, like heart disease, hypertension, joints problem, depression. So so we have to guide them accordingly to have a normal BMI. BMI is calculated from your height and weight. Ideal normal BMI is from 19 to 25, and if your BMI is more than 25, you are labeled as IBM overweight patients, and then you have to control your weight to prevent these all complication, long-term complications. Thank you so much. My idea was to just to give you awareness about the PCOS. Sorry, my slides, I could not share my slides with you, but I have tried my best to make you aware about the disease. So I will leave today with a quote that you don't need to be perfect, but just be better than you were yesterday. So PCOS is tough, but you have to be tougher. So let's win the race. And any question, if you have, then you can ask me. I'll answer your questions. No question on the chat. You can post me any question if you want to ask. I'll wait for a minute. Thank you so